And then I found this reference right here that would be good for your section.
Okay.
So, how are your kids doing?
Ian's good. Dylan got chicken pox. Oh, that reminds me. They made some cute little invites. Like you to come, bring the kids to our chicken pox party.
Chicken pox party?
Yeah.
And you want me to bring my kids so they can get chicken pox from your kids?
Yeah.
Okay. Well, we can't come because I vaccinated my children against chicken pox.
So you can't come because why? Because your vaccine would make them not get chicken pox.
Well, I had them get the vaccine so we wouldn't have to deal with stuff like this. And they have an immunity against it. We're just not even we're not gonna risk it.
So you didn't see on Facebook and all the blogs that said that vaccines will cause autism and they're not 100%?
Well, that was disproven. And if my children develop autism from the result of having a vaccine, that's something that I'm willing to accept.
So what about all the side effects?
My children didn't have anything.
One of the biggest stigmas people have against vaccinating their children is that it causes autism. This is not true. There have been multiple studies that have proven that there is no link between autism and vaccinations.
I chose not to vaccinate my baby because I believe Big Pharma just wants to make us all sick. They just want to inject us with all kinds of chemicals that make us even more sick throughout our life. So we have to keep coming back to them for cures. And we come back and get the cures, but these medicines that they give to us just make us sick with something else. My ancestors never had vaccinations, and they lived to be well into their 100s. My baby's gonna live forever.
My name's Nick. I'm here to tell you why I vaccinate my children, but not in the timeline that the CDC gives you. I believe that children's bodies respond to certain things in those vaccines, and I think their timeline is absolutely terrible to expose our kids so young to those vaccines. So I would say I put about an 8 to 12 month delay in the CDC's timeline for vaccinations. So my children's immune systems have a better chance of fighting these things and their bodies don't become infected with it and take over.
See, vaccines help reduce the risk of infections by working with the human defense system by safely developing an immunity to the disease. The vaccination schedule is designed to protect children, especially young children, before they are exposed to a disease and when they are most vulnerable to an infection.
Why we are vaccinating our children in such high dosages now, and there's really not any good research to prove why we are doing so many vaccinations now. In the 1940s, there were only 4 vaccinations, which you would never get more than 1 vaccination at one visit. In the 1980s, when I was born and grew up, there were only 8 or 9 vaccinations that you would receive before the time that you were 5, and you would never receive more than 2 at one visit. Now there are 14 different vaccinations, and you receive 49 doses before the age of 2. How do you think that sits in the baby's system? It doesn't. You're basically adding tons of toxins to their body, and I just don't want to do
the
that.
World Health Organization, there are 4 vaccination facts that we want you to know. 1. Vaccines prevent 2 to 3 million deaths per year from diphtheria, measles, tetanus, and pertussis. 2. Globally, measles mortality has declined by 74% thanks to vaccines from 2000 to 2010. 3. Polio cases have declined by 99%. And 4. Vaccination is the most successful and cost-effective public health intervention that has happened.
Okay, don't bother inviting us to your measles party either.